I'm Dr. Mian from McMaster University in Canada. Thank you so much for inviting me. Our group had the privilege of presenting 3 ASH oral abstracts. 2 of our abstracts are on this concept of frailty. Now, frailty we know is really important in multiple myeloma because it can impact how long patients can live and how they respond to treatment, as well as how toxic some of the treatments will be. One of the first concepts we looked at is that there's so many different frailty scores and tools, and are they really measuring the same thing? So in one of the first studies that we presented, we showed that actually, if you use different frailty tools, you categorize patients differently as being frail or non-frail. Now that's a bit of a problem because we all really need to be talking a similar language when we talk about frailty. And so we really emphasize that there needs to be some form of standardization so we can all compare across studies and all really talk the same language in order to improve patient outcomes. The second abstract that we presented also, in fact, looked at the similar concept, and it looked at this idea of, does frailty change over time in multiple myeloma? Now that's really important because, just how we think of disease assessment, we don't want to just measure these things right at the time of diagnosis. We want to come back, remeasure them again, and say, if things are changing, am I changing my treatment? So in this large study that we did using an administrative database, we in fact showed that frailty changes over time in the vast majority of patients. So in our study, frailty categorization changed in over 93% of the patients. What was also interesting to note that it could actually improve or worsen. So with treatment, your functional status can change a lot. So in the future, I think the implications of this study will be that we really need to both design clinical trials as well as in the real world clinic, not just measure outcomes like frailty at one time point, but come back after a few months, remeasure them again and say, you know what, if things are changing, should I potentially escalate or change my treatment options as well? So we really hope that this concept of what I call dynamic frailty will really start to be incorporated into settings. The last abstract that we presented looked at the causes of death in multiple myeloma. Especially in older adults, it's really unclear with really good myeloma regimens, what are patients really going to be dying from? And in this study, it was really interesting to note, again, we did this study in a large population setting in Ontario, and it was myeloma. Myeloma is the leading cause of death by far among both younger patients as well as older patients, even in the era of novel therapy. So I think this has really important implications because it highlights the fact that we need ongoing development, good therapy for patients that are both younger as well as older to really move the needle and improve survival for patients with myeloma. I think that was part of our motivation for doing this study because we really wanted to know 2 things. One is among younger patients and older patients, is there a difference in what the leading cause of death is? And then the other thing is, as part of the study, we really wanted to know, the farther you get from diagnosis, is myeloma still the problem? And I think that's the important part. Both in older adults and even for patients that are 5 years and beyond, myeloma is still the leading cause of death in over 2/3 of older adults. And that's, it's improving, but still so much more work needs to be done in that. So I thought that was an important conclusion and the motivation for us doing the study.